Hi, I'm John Joya from Contra Costa County, and I'm here with Dr. Ahwah, who's an emergency room physician and also a practitioner and owner here at NewMD Urgent Care Center in El Cerrito. And we want to talk to you about how to prepare yourself and our community and protect your loved ones from COVID-19 coronavirus. We all can be a part of stopping and slowing the spread of this lethal virus. We are all worried that if we see a large, significant increase in the number of individuals seeking medical care, our healthcare system could become overwhelmed. People could die as a result. There could be serious illness as a result. So we want to ensure that this virus can be slowed down enough so that our healthcare system can handle the load and the surge that they will experience. And Dr. Ahwah is also going to talk about what you need to know as a provider to protect you and your family.
My name is Ian Ahwah. I'm an emergency physician with 20 plus years of experience. I used to work at Dr. San Pablo before it closed, and I'm currently working both as an urgent care physician at NewMD Urgent Care, which I'm one of the owners, and in an emergency room at Sutter. I wanted to get out the information on what's currently available, at least from the CDC, in terms of how to protect yourself from the virus and what we as providers are looking for. First of all, we would like everyone, if they're having any symptoms, such as they're having a cough, they have a fever, that if they're having body chills, that they actually stay home. If they do start to have any trouble breathing, then I would recommend that they either contact their primary care provider or go to an urgent care. The reason I would recommend not going to an ER is that it would be very easy to overwhelm ERs as they're seeing multiple other illnesses and injuries, and that you may have to, one, be separated, and two, perhaps wait a long time, and to be told that that you may or may not have any disease, or you can't get testing. And the worst part is that if you do have a positive COVID-19 test, that you've actually infected a lot of people in a mass gathering in the waiting room of an emergency room. Two is that the way you protect yourself and protect others is that in terms of washing your hands for 20 seconds or more. If you have to sneeze into a paper towel and then or tissue, and then discard immediately afterwards, and then wash your hands. And then if you really want to be good, you could start wiping down with Clorox wipes. Those seem to work in terms of chairs, or if you felt you sneezed on something, that you could wipe it down. The virus is actually transmitted through droplets. So if you're sneezing or you are coughing, you are actually having droplets that you are emanating that can last or land on someone who is close by, and if they touch their hands or mouths with the area of contact, then they can also have the virus and keep spreading it that way. There's no real treatment for the virus other than treating the symptoms. In terms of how we're doing it, handling it at NewMD Urgent Care, is that if someone comes in, we would like you to call prior to your arrival, stating that you're having these symptoms of fever, cough, and trouble breathing and body aches, and we will prepare for your arrival and hand you a mask upon arrival and place you in a separate room, and then we will don a special mask and gloves and be able to see you. Once we've seen you and evaluated, we would wash our hands. We'd also ask you to wash your hands, and then if there's any treatment that's needed, we will treat appropriately and then refer you to your primary care provider.
So Dr. Ahwah, we're still in flu season, and so people may not have coronavirus. It could be one of many other types of colds or flus. What do you recommend for the public?
My recommendation is that everyone gets a flu vaccine annually, and that because the flu is actually just as common, actually more common in the United States, and that there's also other viruses that can cause similar symptoms. Even for kids, there's respiratory syncytial virus, which can cause these symptoms. There is rapid testing for flu and for respiratory syncytial virus that are available at urgent care centers and ERs and many primary care physicians.
Dr. Ahwah, our public health officer has said that people should essentially remain home if they have a fever or a cough, but if they begin to experience shortness of breath, they should seek medical care. What's the best advice you can give the public about that?
I think that the most important thing is the shortness of breath. Many viruses cause fever, chills, body aches, but the shortness of breath is a determining factor in terms of how sick you may be or will be in the future. I think that if you feel that you hear yourself wheezing or you having trouble when you walk, you start getting short of breath or going upstairs, these are significant findings that you should immediately be evaluated by a medical provider to determine if there's a more significant cause. And it could be, many times these things go on to have bacterial pneumonias, or it causes an exacerbation of your pre-existing condition like emphysema or heart failure, where you become fluid overloaded and the fluid starts collecting in your lung. So those are significant findings that you definitely should come in and be evaluated by a medical provider.
Dr. Ahwah, our health officer has strongly urged those who are medically vulnerable, who have underlying medical conditions, to not be part of any gathering because they're most vulnerable. Tell us who they are, what kind of advice you can give the public about that.
The people who are most at risk for having serious consequences from acquiring COVID-19 are those that are immunocompromised, either from medications or pre-existing conditions. And those would include diabetes, people with liver disease, kidney disease, people who are in cancer chemotherapy, people who are receiving immunosuppressive drugs for chronic conditions, whether that may be lupus or rheumatoid arthritis, etc., or psoriasis. So these people are very much at risk, and they have a higher prevalence of suffering significant consequences of having the disease, which oftentimes can lead to severe pneumonias and possible death. For people who have emphysema or pre-existing, they have bad asthma or heart failure, those are direct diseases that affect the lung, and therefore their reserves for lung capacity is severely diminished, and also those individuals are extreme risk.
I think it's important during this time that we not panic, but be prepared and listen to our health officers for the most recent advice, which is we can all be part of slowing down this virus, protecting our loved ones if we follow the social distancing requirements.
I want to get out there that there is no actual treatment for COVID-19. However, if you develop shortness of breath or wheezing, or you feel that you're having just trouble walking without having trouble breathing, then you should seek medical care. Then you should contact your primary care provider or visit an urgent care so as not to overwhelm the emergency rooms.